All right. Welcome to podcast number 4. This is the Glenn's on Health podcast. It's the official podcast of Thunderbird Men's Health. Thunderbird Men's Health, as you know, is a Phoenix-based men's health clinic, and we provide, obviously under Dr. Glenn's watch and through his treatments for men, ranging from TRT to ED to hair loss to skincare and any other things affecting men, right? We'll probably talk about that a little bit more. So
that's right.
So we're just going to jump right into it. Again, my name is Cameron Glenn. I'm co-hosting this podcast, and with me is my brother,
Dr. Jordan Glenn. Welcome, everybody.
Yep, good to have you. And hopefully we can educate and enlighten and help guys find the solutions to their health issues, help them live a better life, right?
That's right. That's the goal here.
That's what it's all about. So we're going to jump right into it. We'll go back into TRT. I know we talked about that a little bit last time on our previous podcasts, but I think there's some lingering questions that we haven't really touched on. Let's jump into the first one. At what age should men begin checking their testosterone levels on the regular basis?
Yeah, I mean, every man, every adult man really needs to have like a primary care doctor that they see regularly. Yearly labs. Now, in terms of checking the testosterone levels specifically, either I would base it on your symptoms. If a man's starting to experience some of those symptoms of fatigue, maybe reduced sex drive, things like that, then definitely would want to start checking the testosterone regularly. In terms of maybe seeing a guy like us, probably around 40. If men are going to have low T, that's usually when they'll start to experience symptoms. Personally, it was like my 40th birthday. It was like falling off a cliff. I don't know. That's how it was for me.
So it was like, bam, you have all these symptoms, and it was just time.
Yeah, it was just time. And, just went to my doctor and I was like, this is what's happening to me. It's got to be something. Just did a panel of labs, and sure enough, the testosterone was low. So
okay, yeah. Interesting. Next question: can TRT improve more than sex drive, like confidence, motivation, focus, and body composition?
Absolutely. That's probably the biggest thing that guys notice right away is they just feel more energy, more drive to accomplish, get their to-do lists done, more drive at work, probably a little bit more competitive at work and just in their regular life. That doesn't mean that they turn into road rage, guys. That's sort of a misconception.
Or their lives are like suddenly scheduled. And they know exactly like what to do.
Yeah. You still,
sure.
It's still, we live in a very complex world right now, and it's hard to know. But you need motivation. You need to wake up in the morning and have drive to accomplish what you want to accomplish. This can definitely do that for a guy, especially when, in middle age, you start to kind of like settle in, I guess, right. So to speak. I think that's sort of the Homer Simpson trope of just a guy who just goes to work and then comes home and watches TV every day. You remember the episode where he like watches so much TV that the couch like forms
around him,
forms to his body.
Yeah.
That's a trope. We don't have to be like that. We can maintain our hobbies and our lifestyle and our energy levels, and this can help you accomplish that.
Cool. Now, I know that some people have concerns about starting TRT. What are the real risks?
The real risks are, for certain people, the increased risk of stroke and heart attack. Okay. And I say for certain people, that really has to do with the increased hemoglobin and hematocrit. And for certain people, genetically, when their testosterone level goes up or is supplemented, their hemoglobin level and hematocrit level can get up. And that can be sometimes to dangerous levels, as high as 18, 19 on the hemoglobin. So that needs to be monitored. and with regular labs. It's not something that happens overnight. It's something that happens over a period of weeks to months when a guy starts. Part of it is just making sure we're maintaining safe levels. Where his testosterone level is in the optimal range. And for us, that's usually around 900 to 1,000. When you get outside those ranges, you start to have some of the deleterious side effects. It's pretty easy to manage that. You can come down on the dose or just get regular blood draws. And when I say blood draws, like phlebotomy with like blood donation, essentially.
Oh, got it.
I do have some guys that I actually will prescribe more frequent blood donation for them, to help maintain that at a safe level. And that's an easy way to manage it.
Interesting. I've never heard of that before. That's wow. Yeah. Well, I mean, I just think back to like bloodletting, like the medieval art of, but there is some, I guess there's treatments where I guess donating blood is.
Yeah, there's this polycythemia, which is not an uncommon genetic variation where men make too much blood anyway, too many blood cells.
Yeah.
But you can imagine, like as a caveman, that might be an adaptation to be beneficial if you were like fighting off wild animals, or more likely like fighting other cavemen,
right?
with pointy sticks or something on a regular basis,
And obviously that wasn't rooted in science either. Like
no.
Yeah, definitely.
But yeah, so some people do have kind of some degree of that polycythemia without actually carrying that diagnosis. They may be prone to high hematocrit levels, and so in rare cases, it may be a contraindication to you being on testosterone therapy, but it's usually not. Usually something that just needs to be managed.
Okay, cool.
So that's probably the most immediate risk. Heart disease. The heart disease risk with testosterone therapy has largely been disproven, and with some pretty big, pretty robust studies. I think that for most men, the increased desire and motivation for exercise and lifestyle changes that come along with testosterone supplementation is going to, by leaps and bounds, outweigh any risk that they may have. Yeah.
Cool. Very good. So when we're talking about testosterone treatments, what are the different kinds of, I guess, delivery methods that you can get with testosterone? I know that guys do injections, but what are some of the other?
Yeah, there's there's definitely the creams, the pellets, and then there's even some oral methods now, Kizotrex, for example, which we really haven't used much. And all of these are kind of just ways to avoid injection. Personally, I think the most reliable, quickest delivery method is the best.
Injection, yeah.
And for most guys, learning how to do self-injections is like it's a very short learning curve. Once you kind of get it down, it's easy. And
can you take us through that real quick?
Yeah, sure. Most of the commercial formulations require an intramuscular injection. And so, if you're getting your testosterone from Walgreens or, like a big commercial drugstore, it comes in a grapeseed oil, which is a fairly thick oil. And so that needs to be injected intramuscularly. So you got about a 25 gauge needle, 1 inch needle, and it needs to go into a muscle belly.
The muscle.
Yeah.
Got it.
Yeah. So, and that can be in the thigh. It can be in the glute. It can be in the shoulder. And now I tend to steer patients towards a compounded formulation with MCT oil, which is I think it's a better product. It's very thin, and it can be delivered subcutaneously. Okay, there may be a little bit different absorption curve with the subcutaneous injection, but as we know, the molecules of steroids, such as testosterone, the way the molecule is shaped, it goes through cell membranes throughout the entire body. So it's going to be absorbed systemically, really no matter where you put it. It's just a matter of, what's the most comfortable injection site. So that can be delivered through a smaller needle, like a very fine needle, right into the fat, usually around the belly or in the arm, really wherever you want to do it.
When we talk about a needle, we're talking about like definitely finer than like a sewing needle or, something like that.
Yeah. Yeah. So this would be like a 27, 29 gauge needle, a little bit bigger than like your insulin needle that you're doing like your GLP medicine with or whatever, but still smaller bore than the intramuscular needle.
Okay.
Yeah.
That's really interesting. Now, I know there's a lot of information out there, and I'm sure that before guys come in and talk to you about testosterone, that they've already done a little bit of research themselves. But is there like one topic that you think, like when guys come in, that you make sure that they really know about? Like, what are, I guess, a couple things that guys absolutely need to know about before they start TRT?
The biggest thing is that this is not like your blood pressure medicine or something where you just get on it and you just stay on it. It needs monitoring. You need to be monitored. And sometimes that's to detriment, but that's to significant benefit as well. Because
detriment, how so?
Well, because people don't want to have to take something that requires blood draws for the rest of their life.
Oh, got it.
Right. Now, if you're just a person, and we should all have regular health maintenance, it can just go along with that in a good way. Not all primary doctors are up on testosterone or really are doing TRT. So having someone like me who knows how to handle it and is willing to manage it with you is a great option. But you can't just not get your blood drawn, once a year at minimum, usually twice a year, to check levels, to check your PSA, and to check CBC, some of these other things to make sure that you're being safe.
So there needs to be ongoing monitoring, blood testing, checking in with you.
Essentially, forever.
Got it.
Yeah. Yeah. So that's something that will keep some people away. I hope not. I mean, if you're a guy in your 40s, you should be getting regular blood draws anyway.
Interesting. Yeah. Okay. We're going to shift gears a little bit. We're going to get to ED treatments, erectile dysfunction treatments. And one of the questions that we want to cover are, why are younger men suddenly experiencing erectile dysfunction at much higher rates than they had in the past?
Yeah, that's a good question. There's debate out in the world, and it's probably a combination of things. The sort of knee-jerk reaction is that it's from, the prevalence of pornography, and, if a man is habitually using pornography, that his brain is trained to respond physiologically to that, and that's what gets his erection. And so when it comes to being with another person, there's a lot of nuance and complications that come along with that. And so, so maybe that may be part of it. We also know that that hormone levels and male hormone levels are generally decreasing in the population, probably as a result of environmental hormone disruptors, both in the food and in pesticides, herbicides, things like that. And so it's a developing science, but overall we are seeing more ED in younger patients.
Right. Doesn't the percentage of body fat, things like that, does that contribute to loss of
It can.
The ability to perform.
It can. When you have prevalence of prediabetes and diabetes at a younger age, and that has microvascular effects as well. The diabetes is probably the greatest risk factor for heart disease, which is related to to the vascular system, development of atherosclerosis in small vessels. And so, yes, from a vascular standpoint, we're certainly, that can be a contributing factor as well.
Interesting.
Yeah.
So can you talk a little bit about what the mechanics of these drugs do? We talked about tadalafil. What's the commercial name for that?
Cialis.
Is that Cialis? Okay.
Yeah.
So how does that work?
So it's a phosphodiesterase inhibitor, PD5 inhibitors, sometimes shortened. It works on a certain size vessel to produce relaxation. Interesting, these medicines, Viagra kind of being the most well-known one, or sort of the first one that was commercially available, were actually developed as cardiovascular medications, and can be beneficial for that
Right.
reason.
Yeah.
And then they said, hey, wow, there's some significant side effects here. So it works at the level of the vessels. So for Cialis is nice because it can be taken regularly, on a daily basis, usually like a 10 milligram. You can use it that way, or you can use it, in a way where you're like, okay, I'm gonna have sex today, I'll take it this morning or something. And it has a really long half-life, 32 hours or something like that. So it stays in your system for quite a while.
How long does it take for it to have an effect? Like if you were to take it, how soon after that could you?
Like half an hour or so.
Oh, okay.
Yeah. But it's not like, a trimix injection where you do it and then you immediately have an erection that lasts, 2 hours. It doesn't work like that.
Got
it. You can have an erection, it goes away, and another one. But when people are starting to have a little bit of ED, what they find is that when they take that, their erection is more natural, but it lasts. They can just maintain stronger erection, more firmness, through sex, and doesn't go away as quickly after. It sort of hangs around for a while. So it can be, use your imagination. It can be nice.
It can be nice.
I don't need to get into too many details.
Right. Yeah. Have there ever been situations where like he just doesn't subside, or you get like
that is a risk with all these
erection,
medications, that's the disclaimer. Like,
Oh,
go to the emergency room or call your doctor if you have an erection that lasts more than 4 hours.
4 hours. I'm like, geez, 4 hours? That would be like...
Thankfully, I've never had a patient that had to deal with that.
Right.
When you have an erection, you have to understand that there is no circulation in the penis. You have blood coming in and it's not coming out.
So it's coming out through the same vessels, right?
No, not necessarily, because it's
work?
like it's venous. So you get venous contraction with arterial dilation. Okay.
Oh, okay.
So blood coming in is wide open and blood going out is like nothing. And so,
because it constricts.
So the blood flow to the actual corpus, which is tissue,
right.
Is like zero. It's just, it's pooling in there. So if it lasts for too long, you can actually start to have damage and necrosis to the tissues of the
tissue.
So that's why they say you got to get to the emergency room. And it's usually just a matter of draining that blood.
Right.
With a big needle.
Right. And as a doctor, you've had to deal with situations like this.
It's usually a urologist that they call. I actually haven't had to deal with that. As a surgeon.
I think that's what I was thinking about, some of these other situations where people have put themselves in a situation where
I have been involved,
right.
In situations where maybe certain sexual behavior gets people in trouble. But
I guess that doesn't really deal with what we're talking about.
But this
here,
specifically, right? No. I mean, I can think of a specific case with a ring.
A ring, yeah. It was.
I think that's what you're referencing. But
so, just for my own curiosity, then. So, as a urologist, would he what would he give the person? Is there some kind of a like a drug, like an injection of a relaxator?
No, there's no reversal agent for this. Not that I know of.
Like if they did have a chronic erection, is there like, it's not a muscle, so you wouldn't use like a muscle relaxer, would you? I mean, I don't know if you're an expert. Okay.
No.
All right.
No. But if someone has an erection that won't go away, you have to drain the blood from the penis.
Got it.
And that's done. Yeah, that's done with a big needle.
And
essentially.
there wouldn't be like more blood coming in because it's constricted, right? Or
I guess getting that. My understanding of it is getting that pressure off the corpus of the penis allows everything to relax.
okay,
Yeah.
got it. Interesting.
Yeah.
Okay, that's more information than I think that our listeners were expecting. But
and disclaimer: I haven't done it.
That. Right.
I haven't had to do. I mean,
Sure.
It's not something that I would do. If
Right.
a patient came to me with that problem, I would send him. I would call up one of my urologist buddies and say, "I'm sending this patient over to you right now."
This guy's on his way over.
Yeah.
Got it. Okay.
Yeah.
That makes sense. And then I think you mentioned that tadalafil was developed, with a different goal in mind, right?
Right.
What
yeah.
are
tadalafil? No, I think they already kind of
just that genre?
Well, I think the
sorry, not genre,
PD5 inhibitors were created to help with cardiovascular issues, but had that side effect. Cialis was, I think, developed more specifically for ED.
Okay.
Yeah.
Now, what are others? I mean, are there any other effects that guys could experience?
Yeah. In fact, some studies show significant health benefits to taking Cialis regularly. One of the ones that I like to talk to my patients about, especially young guys who are working out a lot, is that it can actually help build muscle. There's studies that show it improves muscle growth.
Wow.
And I can report this, personally, is that I've used it as sort of a pre-workout for a few years. Normally you go and get your pump, and we know that the pump itself doesn't necessarily translate to muscle growth, but it's something that can go along with, a good workout and muscle growth. So, it definitely lengthens that pump. You get like I find my pump will last like 2 to 3 hours sometimes. Yeah. Rather than like that 45-minute pump, you're more like a 2-hour pump for sure when you have Cialis on board.
Oh, I might have to talk to you about that.
Yeah. Just give it a try. I mean, I remember the first time I tried it, it was like it was remarkable. I'm like, wow, this is real.
Right.
Yeah.
Regarding ED as well, are there any lifestyle habits that guys engage in, or that they tend to engage in, that would destroy erectile dysfunction? That would affect that?
Yeah. I mean, we can talk about the diabetes thing, and that's definitely a factor, but number one is smoking. I mean, if you have ED and you're a smoker, then you need to quit smoking. That's like and in a lot of cases, the damage is done. You may not be able to.
Is that the vascular constriction aspect of it?
Yes.
Got it.
Atherosclerosis is kind of a permanent change to the vascular system, but just from chronic nicotine use, you get contraction of the small vasculature, and those are the size vessels that feed the blood to the penis. If you're still smoking, then that should be your number one health priority, period.
Right.
And why? I mean, I have like patients. I've heard a patient tell me like that they just started smoking like 3 years ago. And I'm like, what? Who's smoking? I mean, the health risks were documented 50 years ago. And obviously there's chemical addiction and, anxiety and a whole lot of other things that feed into it. But if you're still doing that today, you need to do everything to quit. It is the number one thing that's going to kill you.
What is the most surprising ED success story or transformation you've seen so far?
Yeah, so one of the things we do with Thunderbird Men's is we started doing the Firmex procedure, and that is it's a Botox injection into the corpus of the penis, and it is I've seen actually a lot of happy patients with this guy. These are generally men, 50s and 60s or older, who are starting to struggle with the ED symptoms. Mm-hmm. They can get an erection, maybe they can't finish, or even achieve penetrative sex. So for them, they're just looking for that option. You've got this big, scary option of like a penile implant or something like that. But so we obviously if there were intermediate options, they want to try that. There's pumps and rings and stuff like this that can help you achieve that, but those aren't great options. So when this came along, initially, Frank was kind of skeptical about it. But I've had a lot of really good feedback from patients on the Firmax injection. We call it Firmax. It's essentially a botulinum toxin, same as Botox. And it's a fairly big dose, 100 units injected into the corpus of the penis with a tourniquet, and then it's left in place for usually about half an hour. And then the effects come on gradually over the next week to 10 days and usually last for 3 to 6 months. But I've had a lot of happy patients with that.
Oh, cool. That's really neat.
Kind of a newer treatment. I mean, you don't hear it talked about a lot. Sometimes it's called Bocox. Just kind of, I don't love that name.
Yeah.
It's kind of funny, but
right.
And but it works.
Sure.
Now, for a young guy who just wants to have more staying power, it's not going to do anything for you. This is really only for men who are experiencing legitimate erectile dysfunction.
Got it. Cool. Well, I want to move on to hair loss and topical hair treatments.
Okay.
And the first question that I wanted to pose to you is why some men start losing their hair in their 20s, while other men seem to just keep it forever. They seem to have dark hair, that they've just got a full head of hair. Why is that?
It's all genetics, unfortunately. There's going to be some environmental factors, obviously sun exposure, fungal infection of the scalp, guys who have a lot of dandruff and stuff, that can affect it as well. But it's all genetic. It's really driven by your genetics.
And this is male pattern baldness as well.
Male pattern
right?
baldness, yeah, exactly. Obviously, I knew guys who were in their late teens were starting to go bald, unfortunately. But yeah, you can't really attribute that to environmental factors when they're that young. But
got it.
Genetics play the biggest role.
Got it. What topical treatments for hair loss genuinely work versus the ones that are hype? Stuff you find on the internet.
So, there's a lot of, supplements, kind of herbal things out there. In terms of good medical research, you've got your minoxidil and finasteride. Those are going to be the best treatments. Adding a vitamin E oil and then adding an antifungal of some type, usually as a shampoo in your regular routine, are going to be beneficial as well. Other products to keep the scalp moisturized, like a daily leave-in conditioner, can be helpful too, just to keep the scalp healthy. Red light therapy as well, which, to be honest with you, I don't have a lot of experience with that.
Yeah, I was going to ask about that too.
But it has been shown to have a modest benefit in studies. So really, the finasteride, minoxidil topical treatment, I think, is going to be the mainstay for most men. There's increased risk of erectile dysfunction with oral finasteride, although a low dose has been shown to be safe. I generally shy away from that. I think most men can do just fine with a topical. Now, people are going to argue with me about systemic absorption, and I agree that it is absorbed systemically when it's applied topically, but it's going to be in highest concentration at the spot that you need it, which is on the hair. So,
got it.
Yeah.
So if I come to you and I am looking for hair loss treatment, realistically, what can I be looking for? Am I going to get all my hair back?
The best that you
can I
can hope
expect?
for is maintenance. Okay. And now some guys are going to regrow some hair. Those are usually guys who are early in their sort of hair loss, can expect to regrow some hair.
Oh, got it. Okay.
But in terms
of catch it early.
Yeah, in terms of your expectations, hair maintenance is going to be the best you can really hope for. And it takes diligence. You're only giving yourself a TRT injection once a week potentially, but you're putting that stuff on your hair every day.
Oh, right.
Yeah. So it's usually before bed, a droplet, 5 drops or the like, or spray. We'll do it both ways, but usually before bed.
Do you have to like work it into the scalp?
Just kind of rub it in a little bit, and then wash your hands after. You don't want that to get on your spouse or whatever.
So the product that we offer with Thunderbird Men's Health is called Raven Solution, and it is topical.
Yeah. So it's finasteride, a fluorocinanone acetonide, which is a mild.
That's a mouthful.
Well, it's a mild steroid. Okay, it's going to help reduce inflammation in the scalp, and then you got your minoxidil, and then your tretinoin with vitamin E. So, you're treating. So we're treating the skin. We're treating the vascular component with minoxidil. We're treating the hormonal component with the finasteride, and then we're reducing inflammation with a mild topical steroid as well. So kind of coming at it from different angles, and we've had great results. Our brother actually he was having some pretty significant bald spot, and he says he's regrown most of his hair.
Oh, that's cool. Yeah, I think I remember that too.
Yeah, so he's hitting me up regularly.
Right.
I have to give him a big discount. Yeah.
He's family.
Yeah.
He's the spotlight is on him too, literally.
Yeah.
He's an opera singer, and I think he wants to look his best. So
he does.
It's cool to hear that.
He has some pretty cool parts. He's often, costumed up and makeup and everything. So yeah.
Yeah, that's cool. So speaking of Tom, let's give him a call. Let's see what he's up to.
Okay.
Hello.
Hey, brother. How you doing?
Good. I'm in Vienna.
Oh, awesome. Oh, it's probably late at night there, right?
Yeah, it's 9:30. It's not too late.
Sounds like you're with other
A
people.
little closer to the mic.
Yeah, we're at dinner. We just had our first rehearsal.
Cool.
It's really awesome.
Awesome.
What
Cool.
are you in Vienna for? What are you doing there?
Yeah.
Why don't you talk? Can you talk a little bit about
she's
that?
right beside me. She's you can check her out on Instagram. Her name's Monroe, and she is representing France at this year's Eurovision.
And you're her voice coach.
That's right.
That's awesome.
Yeah, it's pretty exciting, and I think she's going to win. We have a contingent of about 20 people here.
Okay.
And they're a choreographer. There's a choreographer. There's a sound engineer. There's a costumer. There's all kinds of people here. They're just the whole. I don't know. It's like she has the full force of the French government behind her.
Oh, that's amazing.
That's fantastic.
National pride, I guess.
My brother.
That's so cool.
So,
Yeah, no, it's great.
well, we'll watch for it. I don't, you're eating dinner. I don't want to bug you too much, but I thought we just maybe we can tap you for kind of a more formal
I
thing.
would really love that. I think it'd be great.
Okay. Awesome, brother.
All right.
Okay.
Yeah.
We'll talk to you soon.
All right. Peace.
Bye.
That's cool. All right. Is there any other topics that we didn't touch on that you think we wanted to touch on today?
Yeah. So I was kind of getting interested in this. Let me show you. A good picture here. So. Do you do a lot of do you enjoy following like pro bodybuilding at all or anything?
Yeah, I think it's fascinating. I think it's amazing.
Yeah.
I don't know too much about like who are the top guys, but
yeah. So one thing that a lot of people notice is like obviously sometimes they'll get like the belly,
Yes. Yeah. Isn't that I don't know if that's always the case, but isn't it kind of like roid belly?
Well, it's actually from growth. It's usually from growth hormone.
Oh, okay. Got it.
So everybody's response to growth hormone a little bit different, but with high dose growth hormone, you're going to get some hepatomegaly, some enlarging of the organs,
Right.
particularly the liver and spleen.
I remember now. Yeah.
Hepatosplenomegaly. Sometimes the intestines and the mesentery can grow as well. So you get a little bit of this, enlarged belly. But the thing that as a surgeon always sticks out to me, and here, let me show you this, like this picture right here. Look at this guy. So, and a lot of these guys have this umbilical hernia too. So, here's this is Phil Heath has one. I think Ronnie, Coleman in some of his like heyday pictures.
Oh yeah, I remember that. Yeah.
Ronnie has an interesting
Wow.
abdominal wall. Let me see.
Now, is that because their intestines are sort of forced out?
Yeah.
I don't really know the mechanics of that.
So the belly button or the umbilicus is always going to be a weak spot of the abdominal wall.
Because there's inherently a hole there.
There's inherently
right?
a hole
Yeah.
there from where the umbilical stalk is attached. And so when guys lift a lot, I think there's some propensity to be prone to this umbilical hernia. But when you have increased abdominal pressure from lifting, you can get a little bit of, usually it's just a little bit of fat that's popping out through there. But it's almost universal in some of the bigger competitors. If you can find a picture of Ronnie.
Interesting.
Ronnie has this like interesting diastasis recti as well, which is the separation of the rectus muscles, the 6-pack muscles. Yeah, here.
Like the three on each, so like right in the middle, it's kind of separated there.
Yeah, see how he has this big gap right here?
Oh, right. Yeah, I see that.
And then I believe he's had an umbilical. Almost a lot of these guys have had umbilical hernia surgery. So, what is interesting? So what I do this robotic assisted hernia repair. A lot of these guys would get an open hernia repair.
What's open hernia repair?
So where it would actually cut it open,
cut
cut through the belly button tissue, fit a piece of mesh in there, and then sew it up. You end up with this incision right over the mesh, and there's some risk for infection and mesh exposure and stuff. Pretty popular influencer recently had some surgical complication from that.
Oh.
So what we do for this is I do a robotic assisted ventral hernia repair or umbilical hernia repair with mesh. So we go in through 3 incisions way over on the side. So these tiny 8mm incisions are not in proximity to where the hernia repair is. And we can recreate the umbilical dimple. It looks very natural and normal. The mesh is placed on the inside of the abdominal wall. So if you're a pro bodybuilder with a small hernia, come see me and I can fix it for you. But it's funny just how it seems to be somewhat universal in some of the bigger competitors. And it may be that when they get really lean, it's just sticking out more. The techniques we have now for robotic hernia repair are pretty awesome compared to what was available previously. There's a lot of open surgeries for hernias still being done, and that can be good. It can get the job done. But this is just such a better technique now, and I've done it all. I just found that these patients do a lot better. There's a quicker return to full activity, and better overall experience. There's a lot of guys walking around with these hernias. When we find them, as a surgeon, when you find them, you generally want to fix it, because a small hernia inevitably over time can become a bigger hernia and a bigger problem.
As far as recovery time goes, what are you looking at for something like that?
Usually 1 month off of any heavy lifting, kind of a 10-pound limit. Week off of work, even for people with a desk job, just recovering at home. You may need some pain meds and stuff, so you shouldn't be driving around and things like that during that week. But after that month, just easing back into regular activities, including lifting, once the scar tissue sort of solidifies with the mesh, it's about as strong as it's going to be.
Right. And in terms of a hernia, is it mostly just kind of like the look of it, or can guys actually like develop like pretty severe complications?
Oh yeah, you can have a strangulation where piece of intestine potentially, or any other abdominal organ, or even just fat becomes entrapped in the hernia, and gets twisted or kinked where it loses blood flow.
Oh, wow.
And can develop necrosis, and that can be potentially life-threatening.
Basically, you have like this dead piece of flesh that's in there that
or
could
dead,
be
or dead bowel,
Right.
with an obstruction where
Right.
your bowel's completely obstructed. Yeah, it becomes
Okay.
a surgical emergency. Luckily, it's generally rare, but it's the reason why when we find hernias, we usually, if the patient's healthy enough to undergo surgery, we usually recommend surgery.
Oh, okay. Yeah, unless you had anything else to chat about today, I was going to wrap it up there.
Yeah, sounds good. And, I'm sure we'll have more to talk about on the next one.
Right. Yeah. And for those people who are watching, if you want to leave a comment on the video, if there's something that you want us to cover or a specific question that you have, go ahead and drop a comment in there. And while you're there, give us a like, and definitely subscribe to our podcast as well. I think this is the 4th one that we've had, but we don't plan to slow down anytime soon. Check us out on that. Also check us out on thunderbirdmenshealth.com. Again, we have a newish website. It's got all the information on the procedures that Dr. Glenn does. Goes into depth on TRT. We have a lot of different articles on there.
Thanks a lot.
All right.
Have a great day.
Thanks for joining us. Talk to you soon.